Good evening, everybody. Thank you for coming tonight. I have a couple of presentations. I broke them up intentionally. One is non-melanoma skin cancer, and the other presentation will be talking about melanoma. My objectives is to overview the two most common type of non-melanoma skin cancer. One is, which is the most common type of skin cancer, is basal cell, which is the first one. And the second one is squamous cell carcinoma, and then I'll go over the epidemiology, risk factors, how they present, and treatment options. Basal cell carcinoma, this is the most common cancer a human gets. Not only skin cancer, but most common cancer, period. Usually it appears as flat or firm, shiny, or waxy, we call it, area on the skin, typically head and neck, are the most common areas for it. So risk factors for it, UV exposure, the number one reason for it. Arsenic, people who get exposed to chronic arsenic, and over time they develop basal cell carcinoma in areas that never seen the sun. As I mentioned before, it can present as a waxy and a shiny area. It can be red, maybe a little bit flaky or scaly. It can be visible, raised. It can be very subtle, brown area, look like a mole. It can be on the eyelid, and it's pretty subtle. There are many variants of it. Most common variants are nodular basal cell, which are basically, they look like a nodule under the scope. That's why we call it. There is superficial, which is in the very top layer of the skin. There is infiltrating, which has like a little fingers underneath the skin, although it's small on top, but it's big underneath. Treatment options for it, the most common excision, unless it's a certain size or in a certain part of the face. This is the most common treatment for it, and basically local numbing, and if you take the skin cancer with a little bit of clean skin around it, put a few stitches and done. Prevention, avoidance of sun exposure, particularly from 11 to 3 p.m. Ionized radiation, arsenic ingestion, no tanning bed, because sunscreen does not protect you from tanning beds. Protection, SPF 30 to 50 is what I recommend. And basically I say that because as everybody applies sunscreen, we never put enough on the skin. And it depends what sunscreen that you're using. The FDA came out with a new guidelines that will be refined, and there are some haggling back and forth with the manufacturer of sunscreen. So it's key, reapply, reapply.